Chantal is 18 weeks pregnant and attending her booking in history at her local hospital. This is her first pregnancy and it was unplanned. Rochelle, a registered midwife, will be taking her booking in history this morning.
So I'm just about to meet my first woman for the day, going to do her booking history, and from the information gathered so far, her name is Rochelle. Her name is Chantal. She's a 27-year-old primip and her bloods have been fine, no concerns. Her ultrasound tells me she should be about 18 weeks pregnant. Good morning, how are you? I'm
Morning.
Rochelle, one
I'm
of the
good,
midwives today.
Oh, my name is Chantal. Nice to meet you.
Nice to meet you, my dear. Okay, so today I'm just going to be asking you a few questions, gathering some information, just so we can have a better understanding of your current status in your pregnancy and give you the best support possible. This is basically going to involve me asking a few questions about your medical history, previous illnesses, etc. It may take a while, so we'll just try and get through it.
That's okay, that's fine.
No problem. Okay, let's just get started. So I have to ask you some questions about your social history, which can mean some personal questions. Feel free to tell me when, or if you feel uncomfortable, we can just move on.
Okay, yeah, that sounds fine.
Sounds okay? Beautiful. All right, so I'm just going to turn my computer around just so I don't have my back towards you.
This is a cue for eye contact between the woman and the midwife.
Okay, so just skimming through, do you currently have any allergies, Chantal?
Not that I know of. I used to be allergic to cat hair, but I'm not anymore.
Okay, all right, no problem. Okay, so Chantal, tell me what you know about smoking in pregnancy.
The midwife asks an open question to the woman. Well, I know that I shouldn't because it can harm a baby, but I don't really know why.
Okay.
The midwife is giving the woman an opportunity to elaborate. I've tried to cut down heaps.
That's great.
The midwife is showing support for the woman's self-confidence in her ability.
That's excellent. So how much did you smoke beforehand comparing to now?
I used to smoke like a pack a day. Now you're even lucky if I have 8.
Oh, wow. So you've already come such a long way.
Yeah.
Well done. That's excellent. And how have you been finding motivation to cut down?
Rochelle asks an open question to find out the woman's smoking habits and where they originate from. I just told myself that I have to do this. Like, I have to get into shape. I have to get healthier if I want to have a baby. And if that means quitting, so be it. But it's just hard. Like, I've tried to cut down, but my friends smoke, my partner smokes. I can't just point blank quit because I'm around it all the time. And, my friends that smoke have had babies and their babies are okay. So I'm thinking, if I can get to like 4 or 5 a day, it's less than they ever had. Surely that stands for something, right?
Yes, absolutely. Going from a pack a day to just 4 or 5 is massive. It's a massive difference. You're right, Chantal.
Thank you.
And I can completely understand how difficult it would be to quit when everybody else around you is smoking.
Yeah. The midwife shows empathy and encouragement.
So is it okay if we discuss some of the effects of smoking on your baby during pregnancy?
She asks an open question to understand the mother's theory and also gauges permission as it can be a sensitive topic. Yeah, of course, it might actually help me find motivation to quit because, let's be honest, I'd be smoking like a chimney if I wasn't. Look, I did it to keep myself healthy because I thought if I'm healthy, my baby's healthy. If I'm breathing better, baby gets oxygen. If I have an appetite, baby gets all my nutrients so it can grow. The midwife is now gaining an understanding of Chantal's attitude about smoking.
Yep. It's definitely important to keep in shape throughout your entire pregnancy.
Yeah, and that's why I go to the gym. Don't worry, no heavy lifting.
Okay.
But I do like to keep moving.
Okay, excellent. So, essentially the less cigarettes actually helps the baby grow. So I've got a pamphlet here on exactly why. There you go, my dear.
Thank you.
So basically what happens when you smoke is all the toxins you inhale can actually go through to your baby. The same exact way as you're passing on nutrients, you can also pass on these toxins.
Okay. What do these toxins do to my baby? Like, what are the risks?
Okay, well, babies born to mums who smoke throughout their pregnancy tend to be a little bit smaller and can even have risks of being born prematurely.
What's wrong with having a smaller baby? And what can happen while I'm pregnant as well?
Okay, so underweight babies tend to be a lot sicker, and smoking can put you at a risk of miscarrying or experiencing bleeding in your pregnancy from your placenta, pretty much coming away from the lining of the uterus.
Okay,
so pretty much it essentially affects the ability of your placenta to give the baby some nutrients throughout pregnancy to help grow.
Okay, yeah. So can my baby die? Like, I know you said I can miscarry, but I know it's a weird question, but if he's born and he's good and he's tiny, is that okay? Like, as long as he's born, or like, what happens?
Well, Chantal, sorry, the issue is babies born to mums who smoke are more likely to experience sudden infant death syndrome, so
wow.
SIDS. The issue here is when their lungs may not be able to function as well, whether that's because of lung infections or smoking in general.
Okay, right. So, I mean, that doesn't sound really good, but I mean, is my baby more likely to be small and his lungs won't be able to work as well if I didn't smoke? But, I mean, can he die after?
So, Chantal, I just want to make sure you're empowered with the right information to make the right decisions for both your baby and yourself.
Mm-hmm.
So, unfortunately, this is a possibility. It could mean that baby can be born with a lung infection, develop asthma.
Wait, so if he's born and he's okay, he can still develop stuff later in life?
Yes, unfortunately, he can still develop asthma in life or have lower lung function.
Wow, okay.
Yeah, they're more likely to have also some associated behavior and developmental problems growing up.
Oh, wow. I'm a little bit shocked, but, I'm glad we brought it up. I mean, I knew there were risks, but I didn't know exactly what they were.
Yeah, well, I'm glad you asked and we're initiating in this conversation, and I hope it's helped you. And I hope whatever's motivated you can keep you on that path that you've created for yourself. You've already come so far, Chantal.
Thank you. I mean, I want to take it further. I really want to quit. I just want to stop.
Okay, that's great. So how have you managed to cut down this much so far? Let's use that as a way to get you to quit.
The midwife is using the woman's plan already in place to encourage her to cut down. I just stopped and I'd think about my baby and I'd stop and I started to go to the gym and it became my outlet. Like, it really helped, but sometimes you just can't help but crave it. None of the patches really worked or anything like that.
Well, it's excellent, Chantal, that you've given all these different outlets a bit of a try and you found the one that works for you.
Yeah.
So how many times a week do you go to the gym?
Oh, just the once.
Okay, well, that's pretty good. Let's try aiming for a little bit more gym time if that's what helps you keep your cigarette intake down.
The midwife is setting realistic goals for the woman. Yeah, I think I can go like 3 times a week, but what else can I do?
Okay, so you can use the quit line on 13 78 48. Now, I know you said the patches didn't work, but we can talk about the nicotine replacement therapy at your next appointment. And if that's only if you feel like the gym isn't enough. We can also set some goals. If that sounds like something that works for you, we can then formulate a quit plan.
Yeah, I mean, that sounds good. I mean, I set weekly goals originally to cut down, but I never thought I would make it this far.
Well done. And you definitely have made it this far. You can definitely take it further. You're motivated, you've got an open mind, and let's just say by the time you reach about 20 weeks, you can probably cut down from 8 to 10 cigarettes a day to probably 4 cigarettes a day.
Yeah, I think I can do that.
Beautiful. What other goals would you hope to set?
The midwife is consulting with the woman to make a plan that works in cohesion with both of them. Well, I mean, I can always have a conversation with my friends about, like, getting them to stop smoking around me and, getting them to stop making me bump one of their cigarettes.
Okay, that's pretty good. So by the time your next appointment arrives, you'll hopefully reduce to 4 cigarettes a day.
Yeah, I think I can do it. My partner's really supportive and he's trying to quit too.
Excellent. So if you can try and cut down to at least 4 to 5 cigarettes a day, hopefully the next appointment after that, you would have been on the journey to start to quit.
Yeah, that sounds realistic. I mean, my partner's so much better than me. He barely smokes, so it's good that I'm around him. He has like 1 a day.
That's excellent. It's very important that you have that constant support throughout your pregnancy. Okay, well, that sounds pretty good. I'm just going to document here that you're having around 8 to 10 a day at the moment, but wish to have reduced by 4 to 5, essentially down to 4 to 5 by your next appointment.
Yeah.
And then hopefully by your first midwife's appointment, you'd like to have quit.
Yeah, that sounds great. Thank you so much.
That's excellent. No problem. I just want to make sure, Chantal, that you're empowered with all the right information so you can make a decision for yourself, and one that is essentially taking into consideration the best outcome for both yourself and baby. And I know it's not easy talking about smoking in general, so I really commend you for your bravery.
The midwife is supporting the woman and reinforcing self-esteem and acknowledging her bravery and strength in discussing such a sensitive topic.